Hello everyone, I am Hammad Haider and you are watching sqadia.com. Today our topic is the brachial plexus injuries. In this we have 5 sections and we'll be initially in the first section going through what are the types of brachial plexus injuries, what are the pathophysiology and pathomechanisms by which it can occur. Then we're briefly going whether what are the upper and lower brachial plexus injuries and where the lesions can be located, and then how to identify where is the level of the lesion and how to proceed about it. In the second section, we'll be going through the generalized principles of the brachial plexus management. That is, what if the nerve is injured, an isolated nerve is injured or not, or whether a whole root is avulsed, how to manage different types of injuries, such as neotomesis, axonotomesis, or avulsions, and what are their association with other syndromes such as Horner syndromes. In the third section, we'll briefly going through the brachial plexus injuries in children, that is obstetric brachial plexus injuries, and we'll be going through the two diseases known as the Owl's palsy and Klumpke's palsy. And we'll also be briefly going through their management as well as the total brachial plexus injury in pediatric age groups. In the last, fourth and fifth section, we'll be going through the peripheral nerve injuries. The three major nerves, that is the radial nerve, median nerve, and ulnar nerve, we'll be going through in the last section, and we'll be briefly going through the upper motor neurons, upper peripheral nerves, which is exiting from the brachial plexus, such as suprascapular nerve, axillary nerve, and the long thoracic nerve of Bell. Thank you very much. Keep watching sqadia.com.